Hey guys, this is Jeremy at Pittman Physical Therapy, and this is my guinea pig, Brooke. Today we're going to be talking about lower back pain and how sitting for extended periods of time can lead to some tightness that can be addressed really simply with one stretch that can be done incorrectly, very simply, but we're going to show you a couple of corrections to make it more beneficial to you. So, Brooke, go ahead and stand up for me. Face this way. All right. So what I'm going to have Brooke do is put her hands on her hips and just lean backwards as far as I can, okay? Now, come back forward. On the surface, that looks really good, but if you know what you're looking for, there's a couple of quick tests you can do to see if all the movement is coming from her lumbar spine or if her hips are contributing. So, go ahead and fly down on the table right here. Okay, slide down just a little bit. Okay. So I'm going to bring both knees all the way up, have her grab one, okay? We're going to drop this one all the way down, all right? And if that motion had hip contribution and she didn't have any tightness in the hip flexors, this leg would lay flat against the table, okay? As you can see, there's a little bit of gap there. It's not too bad, okay? I'm going to trade legs and put this one down, all right? So that one's a little bit better. So we're going to focus on this left hip a little bit. Okay, come on back up. Okay. So I want you to kneel down with your left knee down. Okay, so this is a pretty common stretch, and I'm just going to ask Brooke to just do it the way she normally would. I'm sure she's been taught before, and if you've gone online and seen any videos about this, this is a good hip flexor stretch, but she's just going to lean in there. See how much motion she's getting there? And that's going to bring in a lot of quad and not that much hip flexor. So we're going to drop out of that. So two cues that we're going to use for correction for that is we're going to do a little bit of a pelvic tilt. And for those of you that don't know what a pelvic tilt is, you're just going to roll your hips under a little bit. Okay, so we're going to squeeze our stomach, kind of suck our belly button in, and just kind of roll that pelvis in. So rolling that pelvis in, and then I'm going to ask her to activate the glute on the left side. And then we're going to move in to that stretch. Is that about all you got? Mm-hmm. All right, and you can see the difference in the motion there. All right, relax all that, drop in, and just relax, relax. No tilt, no nothing, just drop in again. All right, so the difference in getting in there, not isolating the hip flexor versus tilt, squeeze, and that's really isolating that hip flexor stretch. Okay, so we're going to hold that about 10 seconds. We're going to do about four times. Do that a couple of times a day. If you sit in a desk 8 hours a day doing computer work, this is something you can do very easily in your office or in your cubicle just to loosen everything up, and that's going to help with back extension, take a little pressure off those joints, help with your disc pain. So anyway, Brooke, thank you.
Thank you.
All right, we'll see y'all later.